what I want to talk to you about today is how important our vision is and how it's important not just to ourselves, but to our family and to the prosperity of our community. So when we go in our daily lives, we tend to see the world around us, and we don't necessarily visualize how what we're seeing is unique. We typically wake up, we go out, and we get to work, and we don't really appreciate the little things, right? And so by the end of this talk, I hope you kind of start to think about what you would appreciate, and there's a reason why. But first, I'm going to tell you about how I got to be interested in this topic many years ago. So growing up, I had a grandfather who had Parkinson's disease, and if you know anything about it, it makes it so it's hard for you to communicate once it develops far enough, and you have different problems with connecting with people because you just can't move, you can't speak clearly. So my grandfather had Parkinson's, and he was living in India, and so we'd visit him every few years in the summer. One time when I was a young child in middle school, we went to India as a family, and we saw my grandfather, and I was spending time with him on a regular basis while my parents were running errands. Now, you gotta understand, my grandfather, he loved these little cookies, and he loved, to share photos when I was a little kid, and I hadn't seen him for many years. So I was trying to, bond with him over these same things. Now, when he would ask me for the cookies, he could not pick out which ones he wanted, and I knew which ones were his favorites. He was unable to really, share stories about the pictures that I was showing him to try to learn more about our family history. When we took him to the doctor on that trip, since my dad was there, we came to realize that he had cataracts. And so he got diagnosed, he got a surgery. I didn't really understand what was going on at the time. So fast forward to me as an engineer, realizing, I didn't want to keep being an engineer on a regular basis. Now, I called up my old mentor, who's a doctor, and I asked him, hey, Dr. Amadio, can I get a letter of recommendation for medical school? Pretty normal ask. He told me on the phone, you have a great resume for applying, but what do you actually want to do when you are a doctor? Like, what's the point? You already have a great career. What is it that you want to be passionate about throughout your career? Because they're going to ask you this, and they did. But it forced me to think, what is my goal here? What do I want to do? And so I thought back, to my experiences in my family and realizing that, vision is so critical. So I went and I volunteered at the Shankara Eye Hospital in Bangalore, India. So this is a huge hospital that takes in 100 to 200 patients a day for high volume cataract surgery. And so I went there as a volunteer, and I did a lot of different projects, but I also learned a lot about what it means to be blind. So when these patients would first get screened, it would be at these camps in the rural villages. And this was the first time I really came to appreciate how beautiful India was. Kind of like someone opening their eyes for the first time, because every time I went to India, I was stuck in the city, and it's a little dirty, it's hectic, it's city life. Going out into the country, I got to see the beauty of the countryside of India, why people want to travel there. And going into the country and helping these people, one thing I quickly noticed was that just like how you and I would go to the doctor when our parents or our kids are going to the doctor with them to give them support, that would happen. But the thing was, it wasn't because these people, just wanted support, it's that they needed the help. And then whenever we would diagnose a patient to bring him back to the hospital on these buses, they'd always have to have people with them. And it made me realize that these people didn't just want the support, they needed it because they could not see without it. They were literally blind. Now, when they got to the hospital, I always wondered, how does this affect them when they go back? will they be able to appreciate what they see? Will they be able to live a better life? What will happen with their family member now that they no longer need to take care of their patient? And so I started talking to these family members, and I started to realize that they were farmers predominantly, which makes sense being in the countryside, and it was affecting their ability to develop their crop and to be successful in their life. And now, with their vision to their parents restored, they could go and do that again. So the reality is that this visual problem affects not just them, but their family. And I thought that was so meaningful and important. But I also thought that, this may not be something that affects people in America. I never, experienced this, seeing this, being in a privileged state. And so when I started talking to my mentors in India, trying to understand, what I could take back, I started to look into the data, and I found that the researchers who have looked into this find when people are in a low socioeconomic status, like being a farmer, they oftentimes will have the same health problems regardless of the wealth of the country. So looking at India or countries like the US and UK, they have these same problems. Now, when you have these same problems, you're gonna have the same downstream effects where people can't be fully functional, not just for themselves, but their family members. Going back to India now, you have to realize that in India, they have an highly exponential growth of their population. So this problem is not something that has been growing at a steady pace, it's been aggressively growing. And so they've had to come up with ways to expedite how they transfer these patients and treat them. And so they had an operating room, which you had a doctor on one side doing surgery, the next patient was getting prepped, and as soon as they were done, they switched and they do the other side. And so they're moving in 7-minute surgeries, highly safe but advanced in a quick succession. And I thought, when you look at the US, maybe that's something that could be taken. Well, when I go to the clinics, even here in El Paso, I find that these doctors, while they're not going left and right, they are going quickly from room to room. So the reason why this is important is because when you look at the US population dynamics and you look at our own community here in El Paso, we have a large portion of our community that has issues like diabetes, issues like high blood pressure. We have a highly aging population. As our population continues to age, as we continue to have these health problems, as we look into the demographics by ethnicity, you start to realize that just like how India has been accelerating with their issues related to age-related blindness, like cataracts, we're gonna start seeing that more and more here. So it's important, I realize now, to figure out what can we take from what these well-respected high-volume cataract surgery hospitals in India are doing and bring it here to our community. And so when you look at what our doctors are doing, they are on the cutting edge. They're doing things that they're not even doing there. I'm flabbergasted because I'm like, okay, what can I bring? What ideas can I do? What can we take? And one of the things that stands out that's unique to El Paso as a community versus other places I've lived, like growing up in Phoenix, that is also found in India is our community health workers. So we learn about this in our medical school here in El Paso, and they're called promoteras. Now, these community health workers, they aren't people who are doctors or nurses. They're not trained in the traditional sense, but they're on the ground. They're in our neighborhoods, they're talking to the people, they are connecting with people, and they are working hand in hand with some of the great clinics here in El Paso. Now, these community health workers have obviously limited training. They learn from what we can help teach them and what we can help them, recognize so they can bring patients to our attention. So in India, in a similar way, they have these community health workers. And so they've trained them on how to identify different visual diseases based on some initial screening tests. Now, if we as a community can take that same approach and work hand in hand with our community health partners, we can help guide them to identify patients before they get to the point of struggling and affecting their lives. Now, when we get these people involved down the line, we're going to be able to connect the people with where they live here in our community. And this is so important just because just like how I had a hard time connecting with my grandfather, there's kids here in our community in El Paso who want to connect with their grandparents. And just like how I could connect with my grandfather and learn from his history and be inspired and learn about how he worked in the Indian independence movement, the kids here in our community can learn about the different things that their grandparents did that inspired them. Now, this is important because it doesn't just affect the people who are the elderly in our community, but it affects the future of our community as well. Now, if we take this to the next step and we get people involved, this is not something that's just good because it helps people live healthier. It affects the finances of our community because people who are taking care of these grandparents, their parents, are the same people who could be out working, who could be out and contributing to our society. So if you look on the CDC website, they'll indicate that the economic impact of these preventable blindness conditions is over $35 billion per year. Now, this is obviously going to affect communities with higher rates of blindness, like our own, more significantly. So if we want to spur our economic development, we have to think about how do we get people to be motivated to get back into the workforce, to have great ideas, and we need to free them up by helping their family live a full life. Now, another thing going back to India is that they have a unique system to help fund people. So the hospital I worked with was a charity hospital, but what I found out when going to these camps is that sometimes when people could not get in because of the long waiting lines, they would have to seek other ways, and so they'd have to get small loans. And just like how people get microloans from Kiva, which you can go look up later, we need to think about creating funding mechanisms to help people in our community get access to the funds they need so that way they can get their family to see again, so then they too can go back into the community and be productive. Now, if you have this idea that let's get people involved to get people in our at the community level excited about getting their vision back, okay? And let's train these people up so that we're identifying early. If we figure out ways to get the economic stimulus there, so that way these people can go into the community and get their vision taken care of with the help of these funds, then the next step is to say, well, what would they do with this? So just like how I went and saw the countryside for the first time, I realized that these people would be seeing things for the first time. And so when I would talk to them, I realized they were so excited to be able to see their grandkids, to be able to see, their family, but also to see the sunset, the sunrise. And so it made me realize that here in El Paso, we have this beautiful, beautiful geography. We have the Franklin Mountains, the only state park in the middle of the city here in Texas. We have an amazing downtown that inspires people. What we need to do is we need to figure out ways to think about and appreciate these in our own lives so we can better connect with the people who are suffering. So one of the things I'm going to ask you all to do in the next year, between now and TEDx next year, is to go out and think, what do you appreciate? What is it that you really enjoy when you're in your daily life, that you're not stopping to think about? If you were to lose your vision today, and then it would come back again in a year, and you'd have your eyes opened again, what would be the first thing you'd run to? What would be the first thing you'd want to go and see? So what I'm doing for my research project as a medical student here is I'm asking that question. I'm going to these communities in our clinics here in El Paso, working with local doctors, and so I'm getting them to have their patients document what they find interesting after they get their vision back via surgery. And so next year at TEDx El Paso, I'm going to have a display in the foyer where all these pictures that patients have taken will be on display. And you'll be able to come and see and compare your own notes on what you found inspiring. And so I hope when you see that and you compare what you were thinking versus what these patients decided on, you come to realize that we need to connect with our community health workers here in El Paso to be able to get them the resources they need to identify patients. And we need to figure out ways to help patients get the funding and the financial support they need to get their vision cleared up with our great ophthalmologists in town. And that's my TED Talk. Thanks.